Good afternoon. My name is Tim Markle. I'm the Southern Regional Center Director for the Southern Region Children and Youth with Special Healthcare Needs Program. We're out of the Waitsman Center at the University of Wisconsin-Madison. This is Conversations Aren't Showing Up for Kids, where we talk about topics that relate to parents' lives and families' lives, children with special healthcare needs, in hopes that we can maybe make the system a little bit better and a little more understandable, maybe a little more navigatable. I want to remind you that we are recording this presentation. And so anything you say, do, or show will be probably out there forever and ever and ever because it's the internet. So please be careful and do not use any personal health information or personally identifiable information because it will just go on the web and float around. I also want to remind you that I am a number of things, but I am not a lawyer. I am not a doctor. I do not profess to be in any of those professions. So this is not legal advice. This is not medical advice. We are having a conversation in hopes that we're going to be able to help some families out. Really excited for today's conversation about school nurses. Louise Wilson from DPI. She is the nurse health and nurse consultant. I'll let you do your real formal title. I keep messing. I type it differently. Sometimes you're a health and nursing consultant. Sometimes you're a nursing and health consultant. All I know is that when I want to talk about school nurses, I go and I used to try to set up coffee, but now email and we get together. So I'll give you a chance to sort of introduce yourself, and then I just want to start off with this question about, schools for education. Why do we need nurses in school? So tell us who you are, and then make your case about why we need school nurses.
Yeah, sure. Tim, thank you for having me join your conversation today. Passionate about school nurses, love school nursing, and love school children and what school nurses can do for school children. So always happy to be able to talk about that. So as Tim mentioned, I'm Louise Wilson. I'm a registered nurse. I've been a school nurse for 27 years now. I've been at the Wisconsin Department of Public Instruction for about 3.5 of those years. And I am the, as I title it, a school nursing health services consultant for the Wisconsin Department of Public Instruction, is what my name or is on my business card, and that and my email address. So that's what I go by. But again, I've been there for about 3.5 years as a consultant, school nurse for many years, and I thought I would just interesting that you say that. And so I was just kind of looking up, besides being, the consultant for the Wisconsin Department of Public Instruction, in the past, I've been the president and president-elect for the Wisconsin Association of School Nurses. Recently was on the board of directors for the National Association of School Nurses and on the executive committee for the National Association of School Nurses. So really tied with my professional organizations, and the National Association of School Nurses often has position statements and documents on different topics. And in my last role being on the board, I was able to help write some of those, but I was just kind of looking up, again, from a standpoint of, what do school nurses say their role is, and what is from a national level. And so it's gonna come off like I'm reading this, because I kind of am, and looking at my other screen like we were talking about before. So my eyes are going to wander, but I just want to, I thought that this is very interesting too, when I think about this and in the situation that we're in, and why we're not having coffee, Tim, and why we're doing this versus Zoom meeting. But the practice of school nursing began in the United States on October 1st, so not too long ago. I guess I should have celebrated this with school nurses. In 1902, when Lena Rogers, the first school nurse, was hired to reduce absenteeism by intervening with students and families regarding the healthcare needs related to communicable diseases. So really, school nursing started in the United States because there were too many children in New York City area that were absent because of just, all kinds of communicable diseases, as you can think of it, in the early 1900s. And after 1 month of her successful nursing interventions in the city of New York, she led the implementation of evidence-based nursing across the city, Then school nurses continued to, from that time, to provide communicable disease management, but their role has also expanded over those years. So again, we started off as communicable disease managers, I think like we're kind of full circle. I know
Yeah.
that in Wisconsin, people who may listen to this in the future, and as our Isabella, who I see is there, may or may not know that not every school district has a school nurse. School nursing services or emergency nursing services are mandated by statute to be provided in schools. But basically, that just says that you need to have a first aid kit. You need to have policies in place to handle illnesses, accidents, and medication administration. And those policies should be developed with a Wisconsin registered nurse. So that's really basically all it says is, again, first aid kit and have policies. There's other things that would go into that depending on what you're doing as far as the Nurse Practice Act and having a registered nurse supervising if you have unlicensed staff doing healthcare procedures. But that's really basically all that's supposed to be provided, or all that our legislation does. So not every school district, therefore, in Wisconsin has a school nurse, or
Oh,
that school nurse may be covering 3,000, 4,000. I know there's one school district that I think there's like 10,000 students per school nurse.
oh my God.
So because of that, and because of COVID, a lot of school districts are now hiring registered nurses and school nurses. In fact, last week, as I was telling you, I held DPI's new school nurse orientation that we do every year. And of course, again, it had to be done virtually versus in person. So there's a lot of school districts who have hired registered nurses to help because of the pandemic. And so again, back full circle for communicable disease purposes. But as I mentioned, there's a lot of other things that school nurses do, because we all know that a student's health is directly related to their ability to learn. Okay.
Exactly. And
Yeah.
that's, I mean, from the beginning, I mean,
Mm-hmm.
that was, if you don't have a student in school, they're
Right.
not going to learn.
Yeah.
And so from the beginning of helping to maximize that student's time, and these days I also hear the phrase of maximizing the education, being able to learn as much as they can, which means they need to have a certain level of health and attendance. They're going to be able to maximize their
Right.
learning.
And so school nurses, what they do is remove health-related barriers, but they also help do, and this gets lost, but socioeconomic barriers and
Mhm.
all those other demographics that we see as important. And I was just having a conversation with somebody earlier today about, um, school nurses are great mental health workers and deal with the social and emotional issues. I mean, anybody who's ever been in contact with a nurse, either in a clinic or in a hospital setting, know they're the ones who are holding your hands in the middle of the night. They're the ones who are calling you
Yeah.
to say, come into the hospital right now because, mom or dad are not doing well. They're the ones who are there, helping you learn about how to take care of your newborn child,
Yeah.
and all the emotions that go to with that. So that's very much in the purview of the practice of nursing, and there's so many mental health issues that are before COVID and now on top of COVID, and because of the way we're learning, unfortunately, school nurses are being restricted in the fact that because there's so many just the communicable disease issues that we have to deal with
Yeah.
now, and they're really the only healthcare professional in the school too, so they really need to do that. But so they're what school nurses can do in removing barriers, because I mean basically Alina was there, because if kids aren't there, they can't learn, and that's
Can't
the
learn.
basic thing. But if they're itching and scratching because they have pinworms or head lice or scabies, they're also can't learn. I mean, you're too distracted.
Mhm.
Next week, the Prevent Blindness Wisconsin is honoring school nurses because of their work in vision screening. So if you
Yes.
can't see the words in front of you, if you can't see the whiteboard, if you can't do hearing, so we do screenings and help, and along all, not only with the vision screenings that we do, but then you help families access follow-up care and maybe help
Right.
provide, glasses. And not that I say that the school is buying the glasses, but school nurses help connect you to resources, because there's a lot of great, organizations out there that will help you. So, those are the things that school nurses do that I think people don't really understand. I know, school nurses hate it because we think that, people just see us as the Band-Aid, first aid
Right.
pushers, but or medication and that. But really, that's, for a lot of school nurses, is very small piece, especially if you're going to be covering, as myself, when I started out, if you're going to be covering, 4,000 students in 2 towns that are 20 miles apart, and you've got 12 schools, you don't put a lot of Band-Aids on. You're doing a lot of more of what we consider case management, and particularly, for the population that you're talking with.
Right.
Yeah, students with special health care needs. I mean, and those can be from, chronic health conditions such as, as asthma and diabetes and that. But again, I know that some of your members and people who might be listening in are, are students who have, and children who have real, other more demanding health needs, and then how that affects their cognitive levels and their ability to access their education. School nurses are involved with that. We're really the bridge between the educational and the healthcare system, so that my message that I've, talked to you about before is, if you have a child who does have health needs, I really encourage you to reach out to the school nurse, one, to see if they have a school nurse, and if they don't, help advocate that they do. But really, the school nurse is the one who's going to be, when you tell them and you give them the litany of, your child's medical history, which seems overwhelming, and I know parents have it down, and they've, become accustomed to it. That person, he or she, is going to like, oh yeah, I got that, I understand what it means, and I can start thinking about what does that mean then when you come into our world, the educational world.
Yep.
And I intimately know what that world is. I also know that this building has a stairway, or this is a classroom that also has a student, with a health condition that may or may not, it might be in conflict. Like if we were to have 2 children with cystic fibrosis or something like that in a building, that means nothing to a school district administrator or another teacher, unless they've been told and taught by a school nurse, what that means. So really, utilizing your school nurse in that. So I can keep going on. You ask more questions. I just keep talking, Tim. I know, how that goes. You get me rolling. Like I said, I'm passionate about school nurses.
It's like, I really did think that maybe I could just introduce this topic, leave for about 45 minutes, and I could come back, and there's going to be some great stuff. Because I love everything that you're saying. It's just like, I don't have to feed her any questions. Because the one thing that you did remind me of, a couple things. Number one is we work with a lot of complex care kids that see complex care units over at AFCH or possibly down at Children's Wisconsin. And they're working on this project of a shared plan of care that they're trying to put together. What is the optimal care, taking in the patient's likes and dislikes and their needs and their parents' desires and cultural background. And then we encourage them to share it. And we get to school, and sometimes the parents are like, I really do not want my IEP team to have my shared plan of care. So it seems to me the natural receiver of that for the school would be the school nurse, who's going to be able to look at that medical side and translate into what role does the school play in providing that shared plan of care. Does that make sense?
It does. And what I'd also, as I said, we're the healthcare provider in the school. And I was just mentioning this again on another call I was on earlier today. School nurses are nurses first, and then we're school nurses. That's a subspecialty. Nurses are, not only are we holistic in our approach, and so when you talk about, bringing that shared plan of care and everybody that, that's where we live. I mean, we understand that. We are also ultimately, if nothing else, super worried about confidentiality. I mean, it's in our Nurse Practice Act. We can be disciplined against our license if we're not confidential. So in sharing that information with the school nurse is able to take that, and they also then, become experts on, what is student health information and student pupil record information, and the confidentiality of that, and what they need to share or not share with
Right.
people in the regular educational world. So a school nurse can take a look at that, read that, translate that, and you don't necessarily, if you're really hesitant to say, here's the document, put it in their record, it doesn't have to be a part of a student's record. Just some of that information is saying, I've talked with the parent and here's the information, and either, and a school nurse, can create a pupil record that then has some very specific confidentiality requirements surrounding that, or the school nurse can just learn and take that, and as I've been talking to the new school nurses last week, develop a nursing care plan similar to what would be written in a hospital, so that nurse knows how that
Right.
they can work with you, set some goals, see some issues and risk areas. We call it a nursing diagnosis, such as at risk for developing social relationships. Again, you think about all those students
Mm-hmm.
that parents that might be listening to this later at some point might be thinking about that. So so then what can the school nurse do to help facilitate them developing relationships? And then we have goals for the students, saying here's what our goal is and here's how we're going to measure the outcome, and working with that. So those are the things that school nurses can do. They'll keep that information confidential. It doesn't necessarily have to be shared, but there's some really
Mm-hmm.
important things in those shared plan of cares, because I've seen some of them myself. That's really critical. That like, oh, I didn't realize that that's what you were working towards, or that's what your goal was, or help parents articulate that, because again, most of your parents probably are working with special education teams, IEP teams, to
Mm-hmm.
develop an individual educational program, and so school nurses, I found sometimes that was one of my most valuable roles on an IEP team, was to sit there, and again, this is what nurses do, is I'm watching everybody making my nursing judgments, and I'm looking over there and seeing this parent really has no clue, doesn't understand, and I didn't either, because they're school. Well, any system has all these acronyms,
They do. They do.
but and I didn't understand them either. But I totally, understand that they don't understand, or they don't know how to interpret, or when you're, the teacher, the school psychologist is saying they're at this reading level, I'm saying, oh, so I'll be able to kind of stop things and say, hey, do you understand this? And as the parent's trying to articulate what their needs are, I can turn around and say, okay, this is what, this is what we can do in this classroom. You know how we have those pencils, or, just be able to do
Right.
that.
Right.
So, so I think it's really important that again, families understand all the different things that school nurses do, and how you can use your school nurse to be an advocate for your child, be an advocate for you, participate in those shared planning, and even just getting the feedback about what is available or what might not be available at a school, and then at those IEP teams, to really count on the school nurse being that bridge and being able to help interpret that for you. Yeah, yeah.
So don't lose the thought of the IEP team. So I want to come back to that. But
Okay.
we did have a question in the chat box about what a shared plan of care is. So I just want to take a moment to explain a little bit about the general stuff of shared plan of care. A shared plan of care is a living document. So it's made to adjust and to grow with the patient, usually with the patient and a doctor and the care team, where the family has input, the care team has input. They're working on common goals. The shared plan of care is stating the medical background, the preferences of the child, but then what are the goals of the family and the child? Who's going to help work on those goals? So it's not made to just be a description. It's made to be a goal sheet where you're saying, I want to help my child accomplish this, or my child says they want to do this. So it gets written there into the shared plan of care. The doctor's care team has what they're going to do to help reach the goal. The family has what they're going to do to reach the goal. The youth has what they're going to reach the goal. And what if you also had the school involved, where the kid spends 8 hours? Well, we used to spend 6, 7 hours a day at school. But the school is involved as one of the most important players in a child's life. What can their role be in the shared plan of care. And being a medical document makes sense to send to the medical translator, so to speak, be the RN, which would be the school nurse.
Well, it's very
Um,
much as I hear you do that description, from the school standpoint, then it's very much like an IEP. I mean, it really is, but an IEP is,
mhm.
is saying those same things too. What do we know about the student? What's their educational background? How are they performing and functioning in the school system? What are, teachers' goals? Because this is where we'd like to see students progress. This is what the parent, wishes for their child. This is what the student wishes for themselves, but it's in an educational standpoint. And so again, who better to help negotiate between the IEP and what your plan of care is, that is the medical plan, in those same things, than someone who walks those and crosses that bridge back and
Well,
forth all day long. So yeah.
exactly, because what I say quite often is that there's not a kid with a medical need and a kid with the school need and educational need. It's the same kid.
Mhm.
Is they're not separating their world out. If they have trouble learning, they have trouble learning. If they have trouble socializing, it's usually not just at school. If they have trouble hearing, it's usually not just at school. Is this child is part of that whole life. And that's what I really like about school nursing too, is that whole life perspective.
Mhm. Mhm.
Um, Want to just really, really let our family member who's on the call know. You can ask your doctor to form a shared plan of care, but if you want to learn more about it, I will post the URL for the Wisconsin Medical Home Initiative. They are the ones that have been working with grants to support the shared plan of care with the different hospitals. So there will be more information about shared plan of care on their website. I will put that website in the description box when this gets posted for anybody who wants to go check out more about the shared plan of care. And I'll also try to remember to put it in the chat box. But knowing me, that may or may not happen. But we'll try really hard. Now, back to the IEP team. How does a school nurse, how does a family get a school nurse involved on an IEP team?
Well, my suggestion to you is that when you get the invitation to the IEP team meeting and you have a student with medical needs or healthcare needs, that you say, I want the school nurse there, and just tell them that, because what happens, in reality, many times, is that people forget. Often because the school nurse isn't physically in the building, because they're traveling
Mm-hmm.
between 5 or 6, and maybe they are only in the building once a week, and they forget about that. Again, nothing against teachers, but they're very focused on that educational need, and sometimes they forget. And unless particularly if it's a new evaluation, definitely, because that school nurse, and I can tell you a little story about how that works, is going to see and hear differently. But even if if it's an established IEP and you're having a reevaluation, or it's just the annual review, sometimes the school nurse doesn't get invited unless there are nursing services or healthcare services that are listed as related services. And even sometimes when they aren't invited, again, because of our ratios and our business.
Yeah.
And I tell school nurses, that's not right. It's not, it's really technically, not providing, fate for the child, because if you're, as a nurse, are supervising those related services, you need to be there. People can't change or speak for you, so you really need to be there. So the best thing is, just as a parent, is to be aware that you have you have a right to have that expert at the table. Your child has a right to, it's actually written in special education law that people who are knowledgeable about your student, who are qualified, need to be there to make those determinations. It's particularly, again, if you're doing it in an evaluation. So again, so just a little story about, again, how school nurses look at it different. I've had a similar experience as another nurse who actually happened not too long ago, being in the president of the National Association of School Nurses, and had talked about how she was invited to an IEP team meeting, and she kind of invited herself, which is a lot like what school nurses do, because she had worked with the student and was just really concerned about what he was doing. And I'm not even sure, we in Wisconsin try to talk about let's not evaluate them for a special disability category. Let's really look at a comprehensive view. And so I'm not sure what categories or what they were thinking about, but they were discussing the student. And well, I guess I'm kind of mixing between the two stories. So I guess maybe I'll just tell you my story. So anyways, I was sitting there listening to the family talk about their child, and the teacher talking about their child. And really, I think the teacher in their mind was thinking that maybe the child had attention deficit disorder, maybe behavioral problems, wasn't really paying attention. And as they're describing not only, you know, how they were progressing or not progressing academically, but what their behavior was, I just stopped and asked, asked just some key questions and said, so when you're noticing this behavior and you walk up to, I'll just call him Johnny, when you walk up to Johnny, what is his reaction when you tap on his desk? I mean, does he immediately, or does he kind of apologize? Does he giggle, or does he look at you blankly like, how did you get here at my desk? Last time I remember you were across the room and now you're at my desk. And so she described that, and I asked a couple just pointed questions to the parent. Do you notice any of this? And you know, didn't want to alarm the parent, but I said, you know what, I really would suggest that you describe this to your healthcare provider and maybe ask for a neurological evaluation. I would suspect that your child might be having having absence seizures. And again, in this particular story, it played out that yes, the student was having multiple, you know, dozens of absence seizures throughout in an hour. And you think about, you know, how is that going to affect your ability if all of a sudden you just hear a word and then you're on a different topic and they told you to open page 12 and everybody got to page 12, but you didn't even hear that because you had a momentary lapse in your neurological function. And then so being able to then, once they get the diagnosis, explain what that means for that student. And yes, you're obviously going to hopefully treat that child so that's not, you know, a part of their life, you know, going forward, but still what that means and then what, you know, kind of academically it means and that. So again, that's what a nurse brings, because we hear things different, we think differently. Other people are kind of maybe jumping to conclusions. They've, you know, read a lot on WebMD and they think that they know about different health conditions. So again, just that's just a story I kind of intermingled between one nurse's story and my own personal story. But that, you know, again, those things have happened a lot to a lot of school nurses where we hear and see things differently. So again, when you talk about the role of the school nurse, you know, it's if nothing else, but it's to advocate for children.
Which is awesome, which is why we have this thing called Showing Up for Kids. So maybe I could subtitle it Showing Up for Kids, you know, just like school nurses do, would be an appropriate subtitle. So your last comment though made me think that we are living in an age where we think we have a lot of medical knowledge. We have access, more access than ever to medical knowledge. We have access to medical devices. And we think everybody is okay. I mean, school personnel are very trained. They are highly educated and they care about kids. That's why they're in the school. But I was thinking of like a child with allergies. The fact that now a lot of kids are carrying around their own EpiPens. I mean, can't everybody, the EpiPen seems like a very simple instrument to use. But I have a feeling that if you're not comfortable using it, it may not be as easy as the commercials make it sound. So how does that relate to?
Well, you know, I think it's related to another thing. And again, I can tell you another personal story on how that goes. But again, when you look at what the Nurse Practice Act and what it defines nursing as, it's that a particular, and I won't quote it quite, but a particular knowledge base from the biological, physiological, social sciences. So, you know, nurses go to school for at least 2 years, you know, associate degree 2 years, bachelor's degree 4 years to learn a particular body of knowledge and then how to pull that all together. Just like a teacher or a community, I mean, we could say, okay, people who have gone to computer science degrees know a lot more and differently and think differently than those of us who have read stuff off the web or whatever. So there's that, and I think school nurses sometimes fight that because teachers are mothers and dads and they've raised kids, so they think, well, I've got my own kid through a cold or asthma. I think I understand that, but and even with the medical procedures that I've told you before, who is it that taught that parent to be that expert and do those tube feedings and things like that? You didn't come walking into the hospital when they gave you that diagnosis and have that body of knowledge. You were given that body of knowledge by a nurse, and not only that body of knowledge was not only that this is how the procedure is done, but this is how I tell someone who doesn't have that body knowledge to get them to understand how to do that. And as you mentioned, making that hurdle is very different. And I know I've shared this with you before, but an example of that is that I had a student who we knew had an allergy to, I think it was strawberries or something like that, and started having reactions at school. And the first one, they called me and told me that she was having hives and that she was having these issues. So I was able to drop whatever I was doing, come over and talk with her. Kind of went through. No, she hadn't had any strawberries, didn't have any other factors that thought that they were triggering what her known anaphylaxis was. But as I'm talking to her, her symptoms are progressing. And so I, called her mother and said, this is what's happening. I'm going to give her EpiPen. We're going to call the ambulance, and you can either meet us here real quickly if you can get here. Otherwise, I will ride in the ambulance and we'll meet you at the hospital, which we did. It took about 2 weeks for the doctors to start figuring out what else she was allergic to. In that meantime, she had 2 more allergic reactions. And by the third one, the second one, I'd come over there and given her, or I think I was actually in the building at that time, gave her EpiPen. The third time, I'm over at another school district or another school about a mile or 2 away. And the school custodian calls me and says that she's in this. Here's the symptoms. I said, yep, those are the exact symptoms we're doing. Go ahead and give her EpiPen and call 911. And he said, should we give her the EpiPen and call 911? I said, yes, give her the EpiPen and call 911. But he was afraid to. I said, I'm getting in my car right now. I grab my purse, tell the school I'm leaving, run out to my car. I'm zooming down the streets of my town, and still have him on the phone. And he's still saying, should we give her the EpiPen? I said, yes, give her the EpiPen. And as I'm thinking about that, I said, where does this happen in any place except in schools, that you have the custodian who's taking care of a patient who could die at any moment. And the reason that it's the custodian is because the teachers are all busy. It's a small school. The secretary, this person, the student got down to the office, thank goodness. And the secretary is all there by herself. So she's yelling, help, help, help. And the only person that can hear her is the custodian. Now, the secretary, again, very competent person, had seen me give it twice, had been trained a zillion times, knew what these symptoms and that, but it's just that, you sure? I'm not sure what I'm seeing is really what I'm telling you I'm seeing. I'm, afraid of the liability issues. And so I am, driving as fast as I can, telling that I get in the building, still holding my phone. Have you given it to her yet? I'm talking to them in person. No, they hadn't. Get it, grab it, give it to her. And they'd already called 911 at least by that time. But again, it's just kind of overcoming that fear. And so again, you can train people, you can tell people, but there's difference in what having someone that's their license, that's their life, that's what their knowledge base. And I could several stories where that has happened, where again, what I see walking in across the room is different, because right now I could look at your picture here and say, okay, yes, he's relaxed, he's doing this, his oxygenation is okay, no, he's not jaundiced. I mean, all that could go through my mind very quickly, that, you can tell people these are the things that you need to look for, in a protocol or something like that. but again, it doesn't, you know, but again, you know, am I going to fix my own computer? No. Am I going to teach a person, you know, a first grader or a kindergartner how to recognize letters and words? No, I've taught 4 kids how to read. I mean, I've looked with that, but I didn't do the initial. I just helped support that. I would never call myself an expert educator. So again, you know, I think that people need to kind of respect that body of knowledge. And I know that school nurses, sometimes we have a chip on our shoulder because again, we're surrounded. In hospitals, that doesn't happen because everybody respects each other's body of knowledge. In schools, that doesn't necessarily happen because they don't really understand your body of knowledge and how vast that is, and again, all these different pieces. So it doesn't always get respected. So again, my message really is to parents is to advocate for your child by utilizing your school nurse, because they're going to be the one from a healthcare standpoint. Teachers are going to be great advocating for your child educationally, but school nurses will do that kind of from a healthcare standpoint and advocate for educationally. And if you don't have a school nurse, advocate to get one or to increase the school nursing services. So, you know, that's always my departing message, my first message to people. Yeah.
You're not departing yet, because I have one more
Okay,
question
all
that I
right,
want to
good deal.
ask.
All
Well,
right,
actually,
all
I
right.
have
I didn't
two,
know what
but
our
I think the
timeline
first one,
was here.
no, you're correct about the timeline, but I'm just loving this discussion so much that I'm
Okay.
going to violate my own rules. So number one, you mentioned a couple times about advocating for your school nurse and advocating to increase school nursing. Do you have, I mean, is there information on how to do that on like Wisconsin School Nurses website? Or, because I know that you know, I don't want to put you in a dicey situation,
Yeah.
but I also, if you have any suggestions as to how families could
Yeah.
advocate.
No, we don't have anything on the Department of Public Instruction website, and actually even from, you know, the National Association of School Nurses or Wisconsin Association of School Nurses don't really have a document per se that says, parents, here's how you can advocate for school nursing services. So I think it really just comes down to is one, knowing that, you know, the power structure would be to always, you know, talk with your building principal about your concerns in that respect, and then asking and saying, you know, and being maybe clear or making a list of what you think your child's needs are, and say, you know, here's my child's needs. How are you going to meet these child's needs, and who can I talk to that understands these needs, and specifically say, you know, I these are health needs, and so I'd really like to talk to your healthcare expert in your school. And if they say, you know, here's our school nurse, or no, we don't have a school nurse, or our school nurse coverage is really the county nurse, which at this time, you know, is really going to be hard.
Gosh.
And they just come in, you know, once a month to see if we have our first aid kit and are doing medication. Then you can advocate and say, well, you know, I don't know that my child's needs are going to be met with that. And you know, just really, you know, looking at what your child needs and who can provide that, and just having those conversations. So I don't know that there's any check off list that this is what you should do, except just to know that the power makers, I would start, you know, with the building principal,
Right.
who then, if they can't, you know, provide that, don't have that, then it's probably the superintendent. And then to really understand, and I share this with people all the time, in Wisconsin and other places, you know, it's the school board who's really
Right.
ultimately responsible for providing the services in a school district, and they're the boss of the superintendent. So if you really don't like what the superintendent's telling you, you know, go to their boss, which is the school board. And so if you can have relationships, or, you know, sometimes in smaller towns, you might even know at least one of the members of the school board, and start with them, you know, whatever's comfortable. But yeah, I don't really have a checkoff list, but I think that's just
Well, that's
the way
pretty
to
good.
advocate. Yeah. And I have never met a parent who's not passionate about their own child.
Darn right.
So I think that gives you energy, you know, in doing that.
So let's come full circle. And you started off with telling us about Lena. No,
Yeah,
Lena.
Lena Rogers. Yeah.
Oh, can't believe I got that right. Lena, and how school nursing started in the midst of just worrying about communicable diseases and getting students able to learn effectively. How has school nursing changed during this time of COVID? You don't have your school nursing office. You're not setting the kid down. She's not interacting. IEPs are virtual. How has school nursing adapted?
Well, so right at this point, some people are in person instruction. So what school nurses are doing now, because we're having outbreaks and a huge community spread, is that they are doing a lot of contact tracing.
Ah,
Before that, to get kids in the building, they were really looking at and implementing, the infection control and mitigation measures that the
mm-hmm,
Department of Public Instruction, which I helped develop tools and things like that with the Department of Health Services, and making sure all those things are in place. They had the hand sanitizer. What are we going to do about how we're going to implement social distancing? How are we going to do our cleaning? How are we going to have an area that if students are identified as having COVID-like symptoms? So school nurses have been involved with that. And stepping back then, when everybody was closed, and for those that are doing virtual, again, school nurses are still involved with their students. Back then and even now, school nurses are connecting with children to explain what's going on with COVID. Some created some very creative videos about the disease, how to do hand washing, why it's important to do certain things from students. Again, in your particular niche here, there's lots of case management. School nurses can help you, checking in with you to find out, are there some unmet health needs? How is their condition changed or improved? Do you have the resources? I mean, school nurses, in some respects play that, what people would say a social worker role too, but that's really what nursing's about too, is because it's a holistic. If you're
yes.
not getting the food, if you aren't, being able to pay your rent, that's important. And we might have to then also get some extra help from the school social worker and get them involved. But again, those are things that school nurses are concerned about and can be reaching out and have been. Sometimes it's
Mm-hmm.
phone calls, sometimes it's whatever is working out virtually, but following up on that, and then just preparing, because we're all hoping that at some time children then will be back in, and how that will look, and how can we keep your child safe from an infection control standpoint, and have them be in school. And if not in school, how can we make sure that their health needs are being met, and then how can we translate that and making sure that their educational needs are met. And then again, just that whole translating and saying,
Mm-hmm.
okay, they need to be virtual, and because of this health condition or whatever, looking at a computer screen is not going to be helpful. This is what we need to provide, and explaining to that okay, again, this is how this health conditions affects their vitality or their ability to
Mm-hmm.
look at a screen or see a flat screen or see 2D. I don't know if this is 2D versus 3D. I mean, there's just a lot of things that people again, that school nurses can do. But again, it's really a lot of what we would consider kind of case management from a nursing standpoint. But it should be in contact with parents. I know school nurses are. And have been, and again, really offer that to the parents who are listening and will watch this. It's a service that's out there, and I would encourage you to avail yourself of that service.
Well, I want to thank you so much for taking time out of your day to be here. I think and now that people are watching the thing know that I am a huge proponent of school nursing. And so I really appreciate the effort and time that school nurses take. And I really do believe they are ambassadors for our special healthcare needs kids, to the medical world, and from the medical world to the school world. And that a lot of times they're underutilized and underappreciated. But the ones I met are there waiting to help families and support those kiddos with special needs. So thank you for the work that you do. I don't think we have any other questions at this point. And so we're going to go ahead and I'm going to stop the recording. Please hold the line. And Isabella, you can stay on too if you'd like, and just then make a little more formal
And
goodbyes.
before you start the recording, let me just say that
Absolutely.
would encourage people again to know that the Department of Public Instruction does have a school nurse consultant. Reach out to me if you do Google school nursing DPI. You'll see my name all over the place. And so I would encourage you that if you do have specific questions, feel free to contact me also.
So I'll go ahead and I will put up that email in
Okay.
the description as well, so that people
Okay,
can find
sounds
the
good.
DPI school nursing site.
All right. Again, thank you for letting me
Thank you
talk about something I'm
so
passionate
much.
about. So yeah,
I love
yeah,
your passion about school
yeah,
nursing.
yeah.
Yeah. All right. Thank
Thanks.
you
Yeah.
so much. And we'll talk. Maybe I enjoyed this so much. I'll probably have you back in 2021.
Right.
Thanks
Bye-bye.
a lot. Bye bye.